It's really exciting to be here. It's my first time in Hong Kong, and it's exciting to help think about how to make a difference. It's, I think, a really exciting time in technology, if I can have my first slide. And what I challenge you to do today, I'm going to be talking about healthcare and medicine, is thinking about how, in whatever field you're in, how you might start to make a difference in your future careers by often putting together different pieces of technology. So if I can have my first slide, I'll get cracking. Or I could just keep talking. So we know that in medicine, there's a lot of, in healthcare, there's a lot of problems, a lot of challenges in healthcare in general. And one of the issues is how do we take care of, for example, an aging population, particularly in the United States, where many people are getting older and have more medical issues. And sometimes we need technology to help us move slides forward, which might not always work. Let's see. Magic button. This is going to be a really long talk. Unless that works. Innovation. I'm going to press the button. I'll just stand here like this, shall I? So there's many problems in technology, in medicine, and we can think of new ways to address them, whether that's the aging population, how we practice medicine in general, how we use information or don't use information. We live in a very fragmented society often, particularly in the medical world, and we don't often do things in an evidence-based way. And I'm really hoping this starts to work. Let's see. I'll just keep going this way. And there's a lot of new exciting technologies that are coming about that I'll mention today that you can start to think about utilizing in a variety of angles. Digital medicine, nanomedicine, neurotechnology, all are getting very exciting and have lots of applications. And no matter what field you're in, whether it's information technology like computers, finance, different areas of business, software applications, you can start to play a role in the future of healthcare and make a big difference. One of the major areas we can start to make a difference in is instead of treating people when they're sick and they need a new bypass or a stent or a new kidney or liver, is to start thinking more about prevention. I've noticed here in Hong Kong that a lot of people are smoking. I think many of you probably are smoking. The biggest difference you can do to the future of your health is to actually start doing preventative measures, eating healthy, exercising, not smoking, and we can start using technology to move the curve to the left, spending more of our time and resources on education and keeping people from getting sick before we spend most of the money, which we do today, on sicker patients. We really live today in what's called an exponential age, where things are moving very, very quickly. You can see here some sort of trends of how long it took things to be adopted, like televisions and radio, and now obviously the age of the internet and mobile phones. I mean, here particularly in Asia, the use of mobile phones, as you all know, is almost ubiquitous. And that has one of the biggest opportunities to change healthcare. So I want you to start thinking exponentially. Most of our minds, we think linearly. If I took 30 steps across the stage, I'd be 30 paces. If I took 30 exponential steps, meaning I doubled with every steps, 2, 4, 8, 16, 32, by 30 steps, I would be 1 billion paces. I would be around the planet about 8 times. So many technologies are moving at this exponential rate now. And you can start thinking exponentially. There's a few examples. So for example, you all maybe have an iPod. Well, the iPod from 10 years ago, 5 gigabytes, $400. Now it's less than half the price and a huge impact in the measure. Another example you all have, obviously, is the phone. Exponential increases. This is the phone. They used to be really cool when this guy was on the beach with a phone like that. Obviously, now we're in the age of the smartphone, and the smartphone is making a huge difference in healthcare. I would argue if you all had an iPhone 1 now, you're not very cool. I mean, that's got like 5 apps on it. It's slow. The iPhone 4 is actually a lot better than new Android systems, and these are really becoming healthcare platforms. Let me try this one more time. Here we go. No, still not doing it. So when you think of exponential technologies, I think the power of the phone now has about 1 billion times more the power and memory than the phones of, let's say, 20 years ago. One way I've been looking at exponential technologies is, while I'm a doctor by day, I've been teaching a new program at NASA in the Silicon Valley area called Singularity University, and we look specifically at where different technologies are coming together, whether that's in medicine, biotech, robotics, artificial intelligence, energy. And we bring together about 80 students from about 35 countries every summer to learn about different fields and how they can come together and make a difference to impact major challenges, whether that's poverty or energy or infectious disease. And several interesting companies have come out of that, using, for example, unmanned aerial vehicles to carry medicines and drugs around the planet, or turning every car into a shared car, so you can find a car with an iPhone app and unlock it and drive it around. Those are just a few examples. And we're specifically looking at in a new program called FutureMed, how are all these technologies coming together to impact healthcare. So I mentioned the phone is really becoming a platform for healthcare. There's about, I think, 20,000 different apps on the iPhone and Android stores today. And those cross the spectrum from taking care of your exercise and diet to helping you track your medicines. What's getting interesting now is the phone's starting to integrate with new devices. So, for example, a little chip that you can connect onto the bottom of your phone might enable you to spit on the chip and measure evidence of a disease, for example. One example of a major problem across Asia and the rest of the world is diabetes. This is an example of a very new product. It's a glucometer. It can measure your glucose. You attach it to your phone. Not only will it measure your blood sugar, but it can help you record your blood sugar. And when you can see that number and share that with your doctor or your friends and family, that'll enable you to understand your disease better and to control it and have better outcomes. There are many examples of these. Where I think we'll focus on the rest of the talk is looking at several trends of technology. First of all, it's faster. You've probably heard of what's called Moore's Law. As computer speeds double almost every 16 to 18 months, we're having the power to do sort of interesting things. I mean, I don't think you can quite learn yet this way, but soon we might be able to. I think the speed of computing is most evident in the power of imaging, in radiology. The example here of being able to look inside a brain and understand the structure and the function of the brain is giving us immense power in the field of psychiatry and neurology to understand what drugs might be most effective based on the reactions of your own brain as opposed to just trying trial and error. We're able to now take a surgeon and they can look at a scan of a patient, for example, and plan that surgery and almost practice that surgery ahead of time. We can start to have a problem now with all this data, though. We have the faster and faster computing and better imagery. Now we have tons of information. How do we manage that information and make it more useful? Well, one example of making it more useful might be to avoid procedures that used to be kind of uncomfortable, like a colonoscopy, and replace that with what's called a virtual colonoscopy. So now just with a scan, you can replace the physical way and fly through the colon, just like a pilot would in a flight simulator, and find where the problem might be, and do a much better job of scanning and diagnosing early signs of cancer. I've been a pilot for many years. I've been a flight surgeon with a fighter squadron. There's a lot of lessons from the aviation world, the flying world, that we use, for example, in simulation. So pilots who fly airplanes, they spend a lot of time in the simulator. We're learning now to take airplane technology and do simulations in the healthcare world. So, for example, an anesthesiologist or a doctor in the operating room can practice emergency procedures using simulation, have better outcomes. Or if you're a medical student, you can train on simulators and practice procedures that are very difficult to do, and you certainly don't want to try on, let's say, your mother for the first time. So simulation is becoming important. And all of these sort of faster technologies are, I think, summarized in the era of what's called digital medicine. We're now in this era where all of our data is becoming digital. And that has a lot of opportunity, particularly now that we're not only digital, but we're mobile and we're connected to the cloud. So this era of what's called digital healthcare. And one example is my stethoscope is now digital. I don't have a normal stethoscope. I have a stethoscope that has an app connected to it, so I can record and listen to my heart sounds that way and analyze them better. There are now new phones, for example, that I have one here that has sensors on the back of the case, and I can look and do an EKG just using my phone itself and send that to the cloud and send that to my heart doctor, for example. That's another example. There are now other attachments for the phone that can help you look at slides. So think about how you can take mobile technologies and maybe use that to look inside the ear. So if you're a young parent and your child has an ear infection, maybe you can look inside the ear with a little camera and take a picture and send that to the pediatrician, to the doctor who takes care of the children, and maybe they can determine whether there's an ear infection without having to go to the doctor. Smart, simple technologies coming together. How about for places where there are not a lot of eye doctors? This is a pretty simple attachment attached again to a mobile phone to enable diagnosis of eye diseases and how to make a prescription for your eyeglasses. So example of, again, simple mobile technology with simple attachments, improving and in some cases lowering the costs of healthcare. Some of you might remember Star Trek. And this is Dr. McCoy, who has this thing called the tricorder. Well, the tricorder is becoming a reality now. We can now take these mobile devices and have the power of what used to be a $100,000 ultrasound for about $5,000. And these devices are enabling a doctor to look inside the body much more effectively than we could in the past at much lower price points. Another big change that's happening is the digitization of medical records. Most of your doctors still today probably write down your history in pieces of paper. And that makes it very difficult to understand and track things. Now we have the new era of digital electronic medical records. Everything is going electronic. And when things become electronic, we can track them in new ways and start to understand the data, not just about you, but about your family and your neighbors, and make more sense of that information. So the digitization of records is very powerful. Obviously, those records are now becoming evident on the iPads or the different kind of pad type technology. In the United States, where I'm based at Stanford Medical School, every medical student gets an iPad their very first day of school. So almost all their education is now being done on mobile platforms. And now there are a whole explosion of devices for doctors to start tracking their patients using medical iPads and similar technologies. Some of you might have heard of the world of what's called AI, or artificial intelligence. IBM, the big company in the United States, won a big game show. You've probably seen Jeopardy! They were able to make an IBM system called Watson beat the world champions in Jeopardy! Early this year. That has big implications. It's not useful for winning a game show, but what about when you start to use artificial intelligence to be a better doctor? And actually the first applications of IBM Watson is to start playing doctor and reading all the books, understanding all the new papers that come out, and be able to help make better diagnostic decisions and better therapy. So I think one of the things we're going to see coming together is artificial intelligence and healthcare. One small example of that is an app. This is an app that can take a picture of a skin lesion and help analyze that. It will send the data to the cloud, analyze that lesion, say, does this look like a cancer or just a normal mole? And that's an example of potentially being able to use artificial intelligence to replace a dermatologist. So those of you thinking going to dermatology, you could be replaced maybe by certain applications. And all these things I think will come together so that the mobile platforms will have the intelligence of multiple doctors and others together to make better access to healthcare wherever you are in the world. Other examples are the issue that you don't always have to come and visit your doctor. Now you can do like Skype type sessions and have a visit with your doctor instead of having to go spend half a day missing school or missing work. So there's some simple applications for that. There's some very more complex telepresence systems where you can have higher level integrations. There are now new companies coming out where you can pay about $20 US and have a teleconference visit with a doctor just by pressing a button immediately. So that can provide new healthcare opportunities for those who are in remote villages where there's no doctor, or to help one doctor talk to another doctor. So telepresent visits. You don't need to be fancy. Many of you are using texting on your phone. Here, a friend of mine sent me a picture of her skin laceration, and I could help make the diagnosis just using SMS and photos. How about the example of new game technology? I'm sure some of you have used the Microsoft Kinect, where you can do dancing games and move around. Well, many people now are innovating using gaming tools simply to use that instead of for playing a game, but to diagnose a patient who might have problems moving, or, for example, with a stroke or other neurologic problems. Or if you're a surgeon in the operating room, instead of having to take your gloves and press a button, you can just wave your hand and move the slides on a CT scan, for example. Or if you can't visit your doctor telepresently, how about having a robot visit you? There are now robotics being used in hospitals to allow me to visit you, for example, somewhere else. These right now are very expensive. These are $30,000 US dollar robots, but a friend of mine who's an astronaut and a physician has designed this system here just by taking parts off the shelf, and with this it's only $2,000. By putting pieces together of all these technologies that are speeding up and getting better and better and lower price points, we're able to put these things together in smart ways and in more effective ways. How about for the patient who doesn't want to be in the hospital or in the clinic? We now have a whole new set of tools which enable you to measure yourself or your patient or your family members at home. That might be your blood pressure. It might be, in this case, instead of having a whole set of monitors for your heart, that's been shrunk down to a simple patch that you can wear on your chest and help monitor your heart. That's one example. There are many new, very low-cost monitoring devices for consumers. This one's called the Fitbit. It enables you every time you take a step to walk, to count your steps, how many calories you've done, how many steps you've climbed. That can be very effective in changing your behavior because you can share that information with your friends and family on Facebook or on the web. There are new technologies for, again, less than $100 US to help measure your sleep. Sleep is very important in your health. So if you have trouble sleeping or you're trying to improve your sleep, you can wear a little monitor. It's going to track your sleep overnight. So here's some of my data. I can see what my score was, how well I slept that night, and what things might improve my sleep. And again, sleep is very important to overall health. So there's an explosion of these new devices that are very low cost that can start to measure different elements of your life, whether it's your blood pressure and a blood pressure cuff connected to your mobile phone, or scales, a scale you can step on and it'll tweet your weight to your friends. So if you're trying to lose weight, you can use social pressure to lose weight. So many, many devices coming out to apply to healthcare. One of the challenges there is how do we pull all this data together? It's one thing to have a measure of your blood pressure or your blood sugar or your weight. How do you make use of that? Soon we'll have tattoos that are electronic, shrunken down. You can just wear for a week. It'll measure your vital signs. The trick is, this is a lot of data. How do we manage this issue of big data? And I think one of the opportunities, just like your car will have a check engine light on, you don't want to know everything about your car, but you want to know when that little warning light goes on. I think we'll start to see all this data start to come together and be analyzed to make more sense, to help you know when you need to see your doctor, or when after, for example, you have an accident or a crash, maybe for the system to call for an emergency response. So one day, I think not too in the distant future, you'll look in the mirror every morning, you'll have that data from how you slept, your vital signs, your tattoo data. It'll start to tell you what's going on with you, what kind of therapy or optimization of your health might you need. And if, for example, you have a young child, maybe the diaper itself will measure information and send it back to you. There might be more information than you want, but these technologies are getting obviously much more easy. We're entering the era of other technologies coming together called not virtual reality, but augmented reality, where you can look through, let's say, a camera or a phone and see what's happening with a fracture. Or look into the mirror if you're trying to change your behavior and weight. If you look in the mirror and the mirror shows you what you'll look like if you get healthier and you continue to exercise, or if you don't, that kind of virtual reality, seeing the virtual you, can change your ability to stay on top of a new diet or new healthy activity. I'm sure some of you are designers or artistic. One of the other needs we have in technology is to make this information more useful. So this is what a normal lab report looks like. I mean, it's boring to look at. It's not very beautiful. Now for using better user interface, we can start to redesign that information and present it in much smarter and better ways so that you can see what that means and how that makes sense to you and based on your information, not somebody else's. I talked about flying before. One thing we do when we fly airplanes is use checklists. Checklists are pretty simple, and they're not being used in the operating room to help the surgeon make sure that they cut off the right leg, if that's the issue, they don't make mistakes. So checklists are becoming important. All these technologies can come together to make better care. Another new era of fast-moving technology is robotics. So we've been having robotic surgery now for about 10, 20 years. It's getting better and more powerful. And I really could use a robot to press the button here. So if anyone has one, I'll just keep doing this. But robotic technology with surgery is getting more impressive. We're starting to layer on more information, like information from the CT scans. We're starting to have better robotic techniques that can take out, for example, a gallbladder remotely without using any skin incisions. We're starting to connect the brains of patients who can't move at all, who are paralyzed. By putting a small chip on the brain, just by thinking, they can start to control a wheelchair or a cursor or a computer. And even today, you can start to buy $100 devices to help measure your brain waves and start to control things. And where this is going to head is, for example, this patient lost their limb. He can start to control a robotic limb, sometimes just by thinking or by moving muscles that are in the chest. So the integration of smart information and data will come together to make better prosthetics. Or for those who aren't missing limbs, for example, those who are paralyzed, we're now adding robotics onto someone who's completely paralyzed so they can actually walk. So exoskeletons is a new technology as well that's just starting to emerge, and is a combination of technologies coming together. So we're starting to enable the disabled. A couple other trends. Things are getting smaller and smaller. For example, this used to be an accelerometer. It used to be $100,000 in the 1960s. Now it's about $2. You have an accelerometer in most of your phones. So now we can make smaller and smaller devices. So pills that you can swallow, for example, to measure your GI tract as you go through a system. And so we can make better diagnostics that way, or bringing smaller devices onto a contact lens. So in the future, you'll be able to look through your contact lens and see vital data, whether you're in the operating room or maybe what's happening with your diet. If you can see how many calories you have for breakfast, maybe that'll change your behavior as well. A few other things getting smaller and cheaper are laboratories on a chip. Now we can do things with called microfluidics, taking what used to be a big laboratory, shrink it to a lab chip, and we can see and do much more effective diagnostics at a lower price point, which enables us to take very complex medicine and take it again to a remote village, for example. And then when we get really, really small, we'll get to the era of what's called nanomedicine, the ability to build very small devices at very small scale, so eventually we might have very tiny robots moving through our systems and doing things from monitoring to therapy. So that's as things get very, very small. And these are all things that are on the pathway of the exponential. All right, last couple of issues, and I'm out of time, is things are getting cheaper. Obviously, the price of memory keeps getting cheaper. Computers keep getting faster. The cost of sequencing a genome now, you can get a whole genome. It used to be $1 million. Now it's about $1,000. I just had my own sequence done about last month for $1,000. And this is going to bring in this new era of what's called personalized medicine, medicine that fits you, not just everybody. One example of that, I think half of Asian individuals have a gene that makes them very slow to metabolize alcohol. Many of you might experience you turn pink when you have alcohol. That's because there's a single gene that's different. And that's an example of what's called pharmacogenomics, how your genes affect the drugs you take, or alcohol in this case. And that can become more important. When you can analyze your genes and pick the right drug and dose, you'll have much better therapeutics. So there's lots of information from genes to proteins to imagery. Those of you who are computer scientists, one of the challenges is to bring all this data together to make sense of it, kind of the idea of what's called systems biology or systems medicine, so we can start to make sense of all this data and make it really, really useful. Because the information is getting lower cost and more applicable, but how do we make use of that and pull it together? Because what's most important is not just knowing your genes, for example, it's your behavior. How do we modify our behavior, which is the most important thing, smoking, drinking, exercise, to impacting healthcare, is actually changing behavior. And now we have new tools, new games. You play lots of times on video games. How about video games that can start to impact your health? So those of you who like to design games, think about how you can design new games, for example, to help people take their medicine or stay on top of healthier habits. And social networks, obviously, are very important ways now to start studying and impacting health. The last thing I'll mention is how do we get better with medicine? So those of you, I'll mention, who know patients who have cancer, right now what we do pretty much is one size fits all. It's very toxic therapy. We're learning to develop drugs that are much more specific to everybody's individual cancer and to develop more targeted therapies. So in the future, we'll take every single cancer, we'll get a full sequence, and we'll be able to individualize that therapy and give a person an individualized treatment protocol. In the era of stem cells now, we're able to make your own stem cell pretty soon to treat a whole variety of issues, from heart disease to cancer. I developed a new device, which I don't have much time to tell you about, which is a better way to harvest bone marrow. Instead of puncturing the bone marrow cavity 100 times, you can do it once. So when you're thinking about problems, think about problems you experience in your daily life. I was doing clinical work and had a challenge. I thought, here's a better way to do this with a little device, and I invented that. So when you're trying to make a difference, think about what's a challenge in what you're doing day to day and come up with new interventions. And I think the exciting area in the stem cell world, just to close off, is the ability to take any cell, like a skin cell, reprogram it, like you can reprogram a computer, and turn that cell into the equivalent of an embryonic stem cell, so you can make almost any tissue type in your body. And where these things will come together is in the era of printing your own organs. So one area you've probably seen is 3D printing of simple devices. So you can print a violin, you can print maybe pieces of a skull for a surgery. You can now print a prosthetic limb for someone who's missing a limb. We can now start to print body parts and put them together. And we're now just in the era of soon, next 10 years maybe, being able to print a complete organ. We're in the early stages of this now. We can start to print the blood vessels. And when these technologies come together, I think we'll be in the era of 3D printing your own actual organs. So when you start to think about innovation and making a difference, what I want you to start thinking about is how can innovation, it's moving more quickly, it's becoming more personalized, it's becoming smaller and faster, in some cases cheaper. And what I challenge you to do is see where the puck is going. Many of these things are happening very quickly. So when you're thinking about making a difference, think about where things are, where they're going to be in 1 or 2 years, because it's going to be very, very powerful. And it's going to make you a better individual, make you a healthier patient. It'll make doctors and nurses and clinicians more effective. It's going to enhance our ability to take care of people. It's going to enhance our ability to actually, instead of spend most of our time and money on the end of life, and when cancers or heart disease or strokes are advanced, to pick those up early in the age of stage 0 medicine. So I'd encourage you to think about how these technologies are coming together and how you can make a big difference in healthcare as we go downstream. So with that, thank you very much.